Hi, this is Dr. Ganatra from Dent Connect, and we're here completing our Module 1 of Orthodontics Simplified with Dr. Rupali Shetty from India. We have had a good 4 days of learning diagnosis and treatment planning and case selection, and we look forward to Module 2, which begins next week and will end in December, and will enable the clinician to decide when to extract or not extract and better choose their cases for orthodontics. From Dent Connect, we are very excited to announce that we have a couple of courses lined up for you next year. Some of these include Implantology Simplified, Prosthodontics Simplified with Dr. Manav Karla, Aesthetics Simplified with Dr. Varsha Rao, and Dr. Mayur Davda from India will be joining us for Photography Simplified. We also have a special series on Migration Simplified, where we will be talking about the various routes that a dentist from Kenya can take to move to Australia, USA, Canada, the UK, or the Middle East. Stay tuned and keep in touch with us.
My name is Muthomi Njagi. Dr. Njagi still takes some getting used to date. Private practitioner, an associate dentist at Upper Hill Dental Center.
I'm Dr. Ebey Eliud. I am from Turkana County. I practice at the Lodwar County Referral Hospital. I'm a dentist there.
My name is Samuel Mbugwa. I'm a dentist at Embu County. I work for a facility known as East End Dental.
My name is Dr. Sajina Sangale. I have a private practice in Gigiri, Nairobi County. I have been open for about 4 years now, and courses like this are just what I need to grow my practice.
My name is Dr. Mugo Gatonga. I'm a private dental practitioner with Greenleaf Dental Clinic based in Uasin Gishu County, Eldoret, the home of champions.
Relatively new within the orthodontic field, and so I enrolled for this course mainly to expand the clinical scope of practice really. And having seen it on the WhatsApp group between dentists and several other platforms, I thought it's about time that I enrolled for the same.
There was great advertising on it and great reviews from my colleague about the sort of course that was offered. It was very practical, something that could be easily applied and with good follow-up, and that is the most important thing.
For the last few years in the practice, I've realized that orthodontics is becoming a common thing. For every few patients, you realize you have one patient for ortho, and that has driven the demand for the skills, the know-how, and the practice of orthodontics. And I'm happy that with the invent and the upcoming of schools and colleges that can help us improve these skills, we are now able to practice them better, improve. Like for this case of orthodontics, we have been able to improve more. We've learned a lot, and I'm sure this will be translated back to the normal practice.
One to few easy cases, straightforward, but not complex, not none of more complex.
I've been doing mostly simple cases for orthodontics, and up to now, sometimes you refer the ones that are a little bit heavier, like class 2, class 3, you have to refer them. But having gone through this class, I'm now able to do most of them. Maybe the referrals will be minimal, and I believe from Module 2 to Module 3, we'll be in a position to do most of them.
Yeah, I've been doing the orthodontics, but now being here makes lots of sense because I'm able to tie the loose ends and perfect on what I'm doing.
Coming to the class, my expectations have been met. It's very practical with real life patients that I can base all of my learning on. And for me, that is the most important thing.
Yeah, my expectations been met. It's a good course. Now I can tie the clinical based on what I do and the science bit. and of course now my patients will benefit from what I've learned.
Module 1, I'll say, met and exceeded expectation because when enrolling for the first module, basically the expectations were to get a reminder, really, a refresher course on orthodontics, what it is, basic knowledge on ortho. With Module 2, I'm basically looking at enhancing what I've learned. Obviously, having set the standard really high with Module 1, I expect to then get a good grounding on then case selection, how to handle the difficult cases, case by case. We already have started with our initial cases, and so basically we'll be looking for guidance as well in our clinical cases by then, and we're really looking forward to it.
She has opened my mind. She has made even delving further into ortho much easier when you're going through textbooks, research papers. Also the perspective about orthodontic treatment for each and every client. It should be custom made all the time.
She's very personable and very honest about her successes and failures.
She has facts on her fingertips, up to date, meticulous with what she does, and she's very patient when she's teaching. She's able to guide you. You ask questions, you get the feedback promptly.
Dr. Rupali really, and her teaching methods are very, very exquisite, I'll say, because you get a good grounding on clinical evaluation of these patients, the intraoral and extraoral examination of the patients, and then to the investigations, your OPGs, your lateral cephalograms, the interpretations you then get from these radiographs, and how to then join all this information and correlate it to the clinical finding to then get to the treatment planning. She's been excellent. She teaches in such a way that it's very engaging with our students as well. You're able to ask questions in areas that were not clear. You're able to discuss several treatment plans, and it's really been excellent so far.
She changes your view of the whole course, and I'm sure by now I feel like I take ortho from a different view than I used to see.
Yes, I would. In anyone who has a general dental practice, I think it's an essential part of growing a practice in a practical way to encompass a whole family.
For dentists who would like to practice ortho, I would highly recommend.
Yeah, definitely. I have like 3 colleagues in mind that I'll encourage them to just try and see what happens.
I am Dr. Rupali Shetty. I'm the course mentor for Orthodontics Simplified. It's a pleasure being back in Nairobi for the 2nd course of the Orthodontics Simplified. I've been here for 4 days and it's been a great interaction with all the students from the course. I look forward to coming back and helping.
I find that there is a lot of scope for orthodontics in Kenya, and it's been a passion to pass on my knowledge that I have gained over the last 20 years to new enthusiastic dentists who are so passionate about giving the best treatment to their patients. Thank you.